We are Group 3, and the topic we have chosen to talk about is the rationale for interprofessional collaboration in Canada. To begin, we're going to give a brief introduction to interprofessional collaboration in Canada. What is interprofessional collaboration? Interprofessional collaboration refers to a team of healthcare providers such as physicians, nurses, medical laboratory technologists, social workers, physiotherapists, and many more. These healthcare professionals provide comprehensive care to patients and clients by working with the patients, their families, caregivers, and communities. The collaborative practice of healthcare has been identified as a solution to deliver more effective and appropriate care to patients by utilizing various disciplines to ensure complete coverage from patient diagnosis to patient treatment. Researchers have hypothesized that collaboration tends to be more successful when professionals are from disciplines that follow the same values and visions of patient care. When did interprofessional collaboration begin in Canada? The thought of multidisciplinary team first came after the Second World War. However, the need and want for interprofessional care within Canada has grown exponentially over the past 20 years. The growth of collaborative care is believed to be due to the patient complexity, increased financial strain associated with healthcare services, and the need for specialized care. Interprofessional collaboration has been shown to provide a positive spin on the Canadian healthcare system by improving both patient-centered care and evidence-based decision-making. First, we will talk about patient-centered care. The patient is the main goal for collaborative care. Every discipline is responsible for their role in providing optimal care. The patient is included in the care plan to ensure that they approve of the level of care that they are receiving. Next, evidence-based decision-making for patient quality care. Health professionals collaborate together by utilizing best practice guidelines and research evidence to ensure the best possible care is being delivered to the patient to treat and manage their health ailments. Patient treatment is continuously being monitored to ensure it is effective and appropriate. Now we will talk about establishing interprofessional collaborative care in Canada. In the interprofessional collaboration framework, there are 6 competencies. They are patient-centered care, communication, role clarification, conflict resolution, and team functioning and collaborative leadership. Patient-centered care is essential when following the interprofessional collaboration framework. The healthcare team can provide this care by enabling active participation from the patient themselves, the patient's family, as well as the community in addition to the healthcare team. This is done by sharing information regarding the care plan in a respectful manner in a way that participants understand, which entices their participation in the decision-making process. It is also important that caregivers listen attentively to the worries and concerns brought forward by the patient, patient's family, or the community involved. This active participation creates a partnership between the healthcare providers and the patient, patient's family, and the community. This helps to ensure the care plan is realistic and attainable. When it comes to interprofessional collaboration, communication is a key aspect. Proper communication is needed within group discussions and meetings to ensure that there is a common understanding amongst all members of the care plans for the patient. Communication is used to help build trusting partnerships between everyone involved and to relay information used to set goals, develop and implement care plans, and to delegate roles and responsibilities. Role clarification is essential in interprofessional collaboration to ensure proper diagnosis and treatment is given. Role clarification is achieved by recognizing the diverse responsibilities among each individual profession within the team. The key is to collaborate these responsibilities of each profession to merge seamlessly and deliver the best possible care. It is a fact that conflict and disagreement will always be around. The important aspect of conflict in collaborative care is to address the conflict immediately in a respectful manner. This is done by involving all the members of the collaborative team to identify the nature of the conflict and whom it affects, to help ensure a well-developed conflict resolution can be implemented. The next step would be to evaluate the current care plan and see if there is potential for conflict to arise. In doing so, there is hope that adjustments to the care plan can be made to avoid conflict altogether. This ensures that the healthcare team, the patient, patient's family, and community involved can conduct a seamless care plan. The team functioning and collaborative leadership are essential for optimal interprofessional collaboration. This is achieved by developing key guiding principles and ethical values for team to mutually agree on and follow. This is done by group discussion and interactions among the team members. In these discussions, the group will actively reflect on the current care being provided to ensure confidentiality, ethics, resources, and professionalism is all being followed appropriately. It is thought that effective and healthy relationships help to ensure best patient care is given in complex cases by helping to avoid gaps, barriers, and patient reluctance. If all 6 competencies were enacted to their fullest, collaborative practice would be at its best. Legislative changes also help to ensure interprofessional collaboration is being carried out. For example, in 2007, there was a legislative amendment to the Health Systems Improvement Act. The amendment included regulatory changes to professional colleges to help promote interprofessional collaboration. This was done by enhancing relationships between the college and other colleges, key stakeholders, and the public. The Act also amended the Registered Healthcare Professionals Act so that colleges are now obligated to collaborate with other colleges to ensure the healthcare professionals are sharing knowledge, skills, and attitudes towards controlled acts. This will be evaluated to make sure colleges are complying by adding this requirement to their quality assurance programs. Now we are going to compare interprofessional collaboration framework to the midwifery framework in Canada. Prior to January 1st, 1998, majority of midwife-attended births took place at home, attended by lay or community midwives, and their services were paid for directly by their clients. Midwives are very isolated from other disciplines within healthcare. Prior to registration, midwives do not have admitting privileges to hospitals. The primary contacts for interaction between midwives and perinatal nurses then occurred upon the transfer of a client from home to the hospital in the case of a problematic home birth, an inherently difficult situation exacerbated by the nursing and medical professionals' disapproval of home birth in general. Further challenges were faced when midwives began to integrate their practice, which had previously been limited to disciplinary care, into the hospital environment. These challenges came from both the nursing and medical professions who expressed concern over the adequacy of midwifery training, the safety of home birth, and the cost-effectiveness of introducing a new profession into a healthcare system that is already economically overburdened. These concerns influenced the nature of the relationship between midwives and their professional colleagues, especially nurses, who maintained more continuous contact with birthing women and work more intimately with midwives than physicians do. Although nurses and midwives began working together to meet the needs of the childbearing woman and her family in the immediate post-regulation period, they did not share an integrated or coordinated approach to care, but instead practiced alongside each other in what may be described as parallel practice. Now we are going to talk about interprofessional collaboration and its impact at a policy level. The Regulated Health Professionals Statute Law Amendment Act in 2009 was created to enhance the healthcare system. According to Health Force Ontario in 2010, the Regulated Health Professionals Statute Law Amendment Act aims to improve the healthcare system by making team-based care a key component of health college quality assurance programs and to ensure the ongoing competence of registered health professionals. In 2007, the Interprofessional Care Strategic Implementation Committee was formed according to Health Force Ontario in 2010. The committee helped to shape the policy for patient healthcare provider in Ontario to provide high-quality healthcare delivery. The committee acted as a key resource for interprofessional care and education by establishing a dialogue within the healthcare team, disseminating and developing key interprofessional collaboration models and knowledge, and acting as a guidance for interprofessional collaboration implementation with organizations. At a policy level, interprofessional collaboration improves patient outcomes by reducing mortality rates associated with various health conditions. For example, a study conducted by Simpson in 2015 displays that the addition of a pharmacist could help reduce the risk of cardiovascular disease in diabetic patients. Similarly, research from 2010 displayed that a multidisciplinary heart failure clinic can help reduce mortality rates by 29%. In both studies, outcomes were greatly improved when using interprofessional collaboration approach. In addition, the Conference Board of Canada in 2014 reports that making interprofessional collaboration the standard model of healthcare will improve health of patients at risk for chronic conditions. Evidence from research in 2012 indicates that diabetic patients under the care of a multidisciplinary team revealed that they had better patient outcomes in comparison to a uniprofessional team. Patients were less likely to be admitted to the hospital, had better glycemic control, lower rate of ambulatory care, and were more likely to visit an optometrist. In 2007, the Alberta government created a 5-year health action plan. This plan was designed to improve access to health care and reduce waiting times. As a part of this plan, the Access Improvement Measures program enabled the healthcare providers to learn collaborative techniques to improve patient access. Since the plan has been initialized, Alberta Health reports that 85% of participants say that patient access has been improved. In addition, an alternative model for maternity care was developed to allow physicians and midwives to collaborate in order to improve patient care. Therefore, the progress of this action plan resulted in the improvement of patient care and patient access by increasing the level of interprofessional collaboration. At a policy level, interprofessional collaboration also increases healthcare access to rural areas. According to the Northern Policy Institute in 2015, the government's support for interprofessional collaboration helps to improve access to healthcare. An example of this is a Quality Improvement and Innovation Partnership. The Ontario Ministry of Health and Long-Term Care created the partnership in 2007, which aimed to shift from a unidisciplinary team towards a multidisciplinary team of healthcare professionals. As a result, the number of family health teams in rural areas has increased. This increase in interprofessional collaboration will increase patient outcomes, as various healthcare professionals will be in close proximity to these patients. As a result, multiple disciplines will be actively involved in patient care plans. Interprofessional collaboration can also increase the efficiency of the healthcare system. In Alberta, various healthcare professionals such as RNs, NPs, physicians, and pharmacists are collaborating to address medical, social, and lifestyle factors that affect health outcomes. For example, the Canadian Nurses Association reports that an Alberta clinic that followed an interdisciplinary approach was able to reduce hospital admissions by 60% and the length of stay by 90%. Finally, interprofessional collaboration is a cost-effective model. According to the Conference Board of Canada, interprofessional collaboration has the ability to save the healthcare system $3 billion a year. For instance, patients under the care of a multidisciplinary team are less likely to be admitted to the hospital. This estimation only considers the cost of complications associated with diabetes and depression. Therefore, this value could be significantly higher if other conditions were taken into account. Now we will look at the different benefits of interprofessional collaboration at an organizational level. The benefits are developing practice guidelines. Practice guidelines and standards are consistently changing to better fit the needs of healthcare professionals. By evaluating the framework, instruments, and processes used for interdisciplinary collaboration, it would lead to the development of guidelines. Since these guidelines may be replaced or altered, it would essentially implement new practices that would support the function of the team. Gain role clarification for others. This aspect of interdisciplinary collaboration is built on professional relationships that is effectively shared between healthcare teams. By seeking information on the roles of each member and becoming aware of the contributions and responsibilities, members of the team are taking the initiative to communicate. In doing this, they are commendably demonstrating trust between professions. Understanding of languages and cultures of other professionals. This specific benefit is directly related to increasing the perception of interdisciplinary collaboration and changing the attitudes of those associated. We've learned about professional identity and how the attributes of behaviors of one's profession are taught through their educational background. Those with a general understanding of other professionals' values and beliefs would benefit immensely because they understand that collaborating between healthcare providers is a social process that is joined by a group of individuals who share common patient-centered goals. Personal professional growth. By participating in collaboration, individuals are frequently learning new knowledge and skills that otherwise may have been unfamiliar to them. This means that because of the collaboration shared between the healthcare professionals, the outcomes of shared knowledge would lead to innovations and personal professional development. Increased job satisfaction. The benefits of interprofessional collaboration has led to the overall increase in the quality of care that patients experience. Evidence has shown that there is a direct association between the two, and the result of this is related to a positive interaction between the members of the healthcare team. Decrease burnout. While trusting professional relationships are built, interdisciplinary teams have decreased burnout in direct relation to shared workloads and effectual communications and decision problem-solving skills. Positive and efficient staff and environment. Having a work atmosphere that is equal in shared power and is also safe and diverse leads to a healthy environment. Ensuring that the working environment is free from power that is easily influenced is also imperative to maintain a safe working environment. Staff that are efficient in their work require an environment that is physically, socially, psychosocially, and cognitively nourishing. Optimizing their scope of practice. With healthcare, there are areas where overlap in scopes and roles can occur. By having the knowledge of what other professions are accountable for, this allows the improvement of your profession. Eventually, this will reduce assumptions and stereotypes. Now we are going to look at interprofessional collaboration at an individual level. Poor interprofessional collaboration has negatively affected the delivery of health services and patient care. This is shown through data collected by Merrick Swanson, Joanne Goldman, and Scott Reeves. They looked at different healthcare situations that included interprofessional collaboration along with situations that had no interprofessional collaboration, and evaluated patient satisfaction and the efficiency of healthcare provided. It was found that the patients that were treated through interprofessional collaboration had much better outcomes and experienced greater satisfaction than those who didn't. Another study conducted at 3 different community hospitals was organized to see the association between nurse-physician collaboration and patient outcomes. After assessments were made based off patients' conditions, questionnaires were used to assess the healthcare provider's collaboration levels. This collaboration was ranked against patient outcomes, and there was a positive correlation between the amount of interprofessional collaboration and good patient outcomes. This determines that it is very important for healthcare professionals to collaborate when treating patients to ensure the best possible outcomes. Next, we are going to look at the need for interprofessional education. Since interprofessional collaboration has shown to be very important between healthcare providers, it is important to implement interprofessional education to change students' mind about interprofessional collaboration. When the students are taught through informal or formal peer teaching, students' views towards interprofessional collaboration are greatly improved, leading them to be more likely to involve themselves in interprofessional collaboration in their future careers. For example, the University of British Columbia has successfully implemented many interprofessional education programs into the healthcare program schedules. This leads to their students to become more proficient in collaborative practice. It was seen at the hospitals around the university where these students conducted their placement that they were more capable of interprofessional collaboration than previous students without interprofessional education. This helps to show when students are exposed to interprofessional education during their education process and clinical placements, they become better collaborators, leading to better patient outcomes. We will now look at the SWOT analysis in relation to interprofessional collaboration. SWOT stands for S, strengths of interprofessional collaboration, W, weaknesses of interprofessional collaboration, O, opportunities of interprofessional collaboration to thrive, and T, threats of implementing interprofessional collaboration. The model of interprofessional collaboration is on the current agenda for the Canadian healthcare systems. Although not an entirely new concept, evidence-based practice and research suggest that this model is undoubtedly successful. However, with all changes, implementing this form of collaborative practice comes with challenges. The following analysis will focus on the SWOT framework for evaluation, which will discuss areas of strengths, weaknesses, opportunities, and threats related to interprofessional collaboration. Interprofessional collaboration offers numerous benefits to the Canadian healthcare system, with the most significant being a heavy focus towards patient-centered care. Moving forward from a previous medical and disease-oriented approach, research and literature better supports the idea that putting the patient at the center of their care enables better care and service delivery, as well as better patient outcomes. As such, Fox and Reeves in 2015 suggest that interprofessional education fosters the attributes of an effective healthcare team that allows patients to become more actively involved in their care plans and to feel as though their healthcare needs have been prioritized. Through implementing this approach, there is a simultaneous effect in holistic healthcare delivery. Complex health issues are best handled from the expertise and perspective of collaborating health professionals to offer comprehensive assessments, maximize coordination, and implement an effective integrated plan of care. The idea of holistic caring is to offer care that addresses the person as a whole rather than separate entities. Thus, collaborative practices require a variety of healthcare professionals from various disciplines and specialties in which can offer a holistic approach to care and promote optimal patient outcomes. Moreover, job satisfaction and increased staff morale have been found to be direct benefits of adopting interprofessional interventions. To highlight this idea, a group of researchers studying interprofessional education found that there were high reports of job satisfaction due to reduced workloads related to the implementation of interprofessional collaboration practices. The unique educational and clinical backgrounds of the members of an interdisciplinary healthcare team unintentionally allows for more fairly divided tasks and which ultimately decreases individual workloads. In the results of this, it can be expected that increased staff morale and less incidents of stressful working conditions will occur. Despite the benefits of implementing interprofessional collaboration in healthcare settings, there are still some areas that need to be considered for improving. As technology has evolved, especially for healthcare purposes, it is inevitable to implement a new system without utilizing such advances. More specifically, the modernized technology uses today in healthcare settings allow for more convenient communication, storing files, and documenting patient care notes. The issue with this arises, however, when the privacy and confidentiality of patients is put at risk. When collaborating with colleagues via telephone calls or emails, the risk for breach of confidentiality is heightened. Broussard and Broussard in 2013 suggest that a healthcare setting utilizing such means for communication and information storage must ensure the security of their networks and further mention that portable devices are not ideal as they can be easily misplaced, lost, or stolen. Although technology adds a level of convenience when communicating with colleagues, health professionals must recognize the need to be more aware of their surroundings when engaging in private conversations and utilizing their respective devices in appropriate areas. Moreover, with all the challenges, there needs to be adequate funds to support the desired outcomes. Kinsella, Maghels, and Winters in 2015 note that sufficient funding must be available to support and sustain collaborative interventions, as well as require fair resource allocations to ensure all areas of healthcare receive equal funding for interprofessional collaboration. In addition, interprofessional collaboration has been identified as a potential mechanism for fostering healthy healthcare work environments and solving challenges that health resources workers are struggling with. However, not enough literature and research exists to fully support these claims. Finally, interprofessional collaboration appears to be the first model of its kind to offer holistic solutions and challenges faced by the Canadian healthcare system. As mentioned previously, the care approaches utilized by midwives differs greatly from interprofessional collaboration principles. This finding, along with the lack of literature evidence, suggests that there is a definite lack of models to compare interprofessional collaboration to. Ideally, comparing two healthcare models to weigh the advantages and disadvantages is required to determine success of either model. However, in the case of interprofessional collaboration, the literature search revealed no comparing healthcare approaches. While interprofessional collaboration is in the implementation and development stages, key opportunities for interprofessional collaboration to thrive in will be examined. Rural healthcare settings have been found to face different challenges with collaborative practice than urban facilities experience. However, working in a remote setting can offer unique advantages to foster interprofessional collaboration. Developing interprofessional healthcare teams in rural settings and promoting the effectiveness of the associated healthcare delivery can attract health professionals and prepare them for treating remote populations, as well as learning to collaborate with other providers from distant facilities. Likewise, healthcare facilities utilizing traditional uniprofessional approaches to patient care serve as optimal candidates for implementing collaborative interventions. Breenza, Dan, Long, and Wolf in 2014 reiterate this idea and state that the shortage of primary care workers has forced the healthcare system to adopt interprofessional principles in efforts to move away from the current silo approaches. These efforts are aligned with the purpose of interprofessional collaboration, which is to bring healthcare professionals together to share expertise, develop mutual understanding, collaborate knowledge and skills, and work together towards a common goal. Additionally, interprofessional education and healthcare curriculums must be implemented to support the transition to interprofessional practice in the clinical setting. As previously discussed, educating health professionals while still in school is a key to decreasing the silos of knowledge, shaping graduates as effective collaborators, and preparing them to work in interdisciplinary teams. Interprofessional education requirements will ensure that students gain better understanding of the roles and responsibilities of other healthcare professionals for which they will be collaborating with. Not to mention, it is easier to implement interprofessional collaboration principles early in their education, rather than later in practice, which makes healthcare curricula an advantageous opportunity to support interprofessional collaboration. It has been argued that the most prominent barrier to interprofessional collaboration involves resisting the change what may or may not already be working. A sense of fear can often be the driving force behind this reluctance to alter one's normal routine, especially with the idea of interprofessional collaboration being quite new to some healthcare facilities. Likewise, Teresa Porolsky in 2013 identified that professional roles and cultures, staff attitudes, and both professional and personal identity characteristics can hamper collaboration between healthcare providers. Professional territories and turf issues can arise when introduced to the idea of sharing one's workspace and knowledge, and giving up years' worth of uni-professional practice. As humans, it is also almost inevitable to encounter a drastic change without fear or concern of the end result. Thus, when put into the context of an individual's career, the hesitation can be expected. Moreover, role conflict and confusion is likely to occur during the implementation process, as healthcare professionals who have not worked collaboratively in the past have little knowledge of other providers' roles. In fact, it has been suggested that forming interdisciplinary teams takes time and effort due to the complexity of the healthcare system as a whole, as well as the varying education and clinical backgrounds of its members. In order to effectively develop a functioning healthcare team, its members must recognize the level of skill, knowledge, and expertise their colleagues bring forth, and further understand how to utilize their abilities in such a way that will benefit the team and the client. With that being said, communication is a critical component during this process. Ferenda, McWilliams, and MacArthur in 2016 note that the lack of communication has a detrimental impact on team functioning and patient outcomes. This can be seen in delayed treatments, practice errors, and can jeopardize patient safety. Effective communication has therefore been considered a priority across the nation. Challenges with fostering effective communication includes poor confidence, lack of experience, and the various distractions within healthcare settings. Implementing interprofessional practices can help overcome challenges with communication in that it will provide professionals with more opportunities to communicate with colleagues, develop confidence, and enhance their abilities to remain focused on the task at hand. Lastly, patient noncompliance has also been considered as a threat to interprofessional collaboration. Gunther and Giblu in 2016 described this barrier to occur when the client refuses to be a part of the collaborative process, such as declining internal referrals or withdrawing from all interactions that promote interprofessional practice. This challenge is perhaps the most difficult one to overcome, in the sense that the healthcare system cannot force a patient to engage in collaborative interactions. Ultimately, it is the client's choice and their right to seek health services and accept those referred to them. Thus, conquering this obstacle is difficult and relies solely on patients' will to participate. Thank you for taking the time to watch and listen to our presentation. I hope we have been able to provide you with a strong rationale for interprofessional collaboration.